Bumubuti man po ang sitwasyon ng COVID-19 dito sa Metro Manila, taliwas naman po yan sa nararanasan ng ating mga kababayan sa ibang lugar tulad sa Zamboanga City, kung saan kamakailan po ay pumalo nga daw po sa 23.04% ang 7-day positivity rate. Kaugnay po niyan ay makakausap natin ang tagapagsalita ng Zamboanga City COVID-19 Task Force na si Attorney Kenneth Beldu. Good morning po, Attorney.
Good morning po, ma'am, and thank you for having us in your program.
Opo, Attorney, ano ngayon ang situation on the ground dyan sa Zamboanga City? Lalo na po sa mga ospital, overwhelmed po ba ang mga healthcares natin dyan? At marami daw po ang nakasick leave, tama po ba ito?
As of now, ma'am, we have recorded a total number of 17,882 confirmed cases. And out of this, meron po tayong 2,551 active cases. And tama po kayo, ang sinabi nyo kanina na meron tayong 7-day positivity rate at 23%. With respect to our hospitals, our bed occupancy now is at 86%, which is deemed to be a critical level. And the Zamboanga City Medical Center, which is the center for our COVID referrals here in the region, has already reached its maximum capacity po.
Opo, Attorney, dito sa mga active cases na naitatala, karamihan daw po na tinamaan ay nasa severe o critical na?
Most of the cases, they remain to be at the asymptomatic, yung ating mga asymptomatic cases. Pero yun nga lang po, marami din pong mga severe cases, especially sa mga older age groups. Right now po, ang ating breakdown of our cases, we have the mild cases at 38%, the moderate cases at 3.5%, yung severe po natin is 5.3%, and the critical is at 1%. Asymptomatic remains at an all-time high of 52%. But the problem po, ma'am, is because of the total number of active cases that we have right now, definitely yung severe cases at 5.3 is still consists of high number of patients po, considering that limited lang naman po yung mga hospitals dito sa Zamboanga City, and we also cater to patients coming from outside of our city, from the entire region. That is why we really feel the effects of the increased number of severe cases. Right now po, ma'am, we really have a shortage of our oxygen, which is a concern that was brought forth by the city mayor, Mayor Ben Clima po, to the government. We also have a lack of supply in ICU and COVID-19 beds in the hospitals. And we're trying to address these issues by several measures that we will be undertaking in the coming days po.
Opo, so sinabi niyo po mukhang nagkukulang po ang supply na ng oxygen at meron na po bang natumugon dito sa panawagan ninyo?
Yes po, ma'am. Last week, the mayor facilitated the transport of these raw materials of oxygen coming from Cebu. And we have also coordinated with other suppliers. And in the coming days, we're expecting na this will be addressed po, ma'am. So really, it's really the problem of oxygen. Kasi po yung reason bakit po nire-refuse ng ibang mga hospitals yung entry ng mga COVID-19 patients is because wala na po talagang supply ng oxygen.
Pero Attorney, masasabi mo sa mga susunod na araw ay hindi nyo na magiging problema itong oxygen dahil natutugunan na po ito?
Yes, ma'am. The city government is now looking into suppliers that can give us the needed supply of oxygen. And aside from that, ma'am, the problem really is the congestion of our hospitals. Because of that, the city government is going to convert some of the isolation facilities to become step-down and step-up facilities, where our patients, instead of bringing them to the hospitals, those exhibiting mild to moderate symptoms, for as long as hindi naman critical, we can put them in our step-up facilities where there will be a semi-hospital setting. Kasali na po yung provision of oxygen. So our mayor met with Mayor Benji Magalong, our contact tracing czar, and some measures were taken to address the issue on the lack of oxygen. We're now making the necessary coordination po, and we're very thankful for the support of our national government in addressing our problems here in Zamboanga City.
Opo, attorney, dito sa COVID-19 report ninyo noong October 11 ay meron po kayong naitala na 34 na reinfection. Araw-araw po ba kayong may naitatalang ganito na reinfection, attorney?
Hindi naman po ma'am, no. It's if you will note the numbers, it's minimal compared to the total number of active cases. So hindi naman every day, but the fact that there are reinfections is quite alarming, and aware that it could be because of the Delta variant. That is why we're having this surge of cases, considering that in the past, when there was no Delta variant yet in our city, our cases were not that high. Right now, we're averaging 150 cases a day, registering an average of also around 10 to 12 deaths a day. So the cases here in Zamboanga is quite alarming. And so that is why we continue to appeal to our residents to really observe the minimum health protocols and to avoid social gatherings. Kasi alam naman po natin, dyan po natin talaga makukuha yung infection pag madami pong mga tao.
Opo, attorney, ano po ang quarantine classification ng Zamboanga City at ano po yung naging tugon ninyo dito sa panawagan ng healthcare workers na mas may quarantines dyan sa Zamboanga City?
Tama po kayo ma'am, no? Merong hiling ang ating mga health workers, pinapangunahan ng ating Zamboanga City Medical Society, kasama din po yung ating Private Hospitals Association of the Philippines and yung Philippine College of Physicians here in our city, na humiling po sila kung pwede po na maitaas po yung ating quarantine classification. Right now po, as based on the information relayed to us by Secretary Galvez, our request for the modified enhanced community quarantine is being considered by the National Interagency Task Force. Kasi po sa ngayon ma'am, nasa GCQ ho tayo, and kailangan ho natin na mas maghigpit po. Yun nga lang po, the challenge really is for the local government to also assist the sectors who will be affected by more strict quarantine classification. Sapagkat alam na po naman po natin na kapag tayo'y mag-MECQ, marami pong tao ang maapektuhan sa kanilang hanap buhay. So ito pong desisyon na tumaas po yung ating quarantine classification, it's a decision that was not taken lightly by the local interagency task force, knowing that there will be a lot of people po who will be displaced also. So we're now just waiting for the decision of the national government insofar as the quarantine classification of Zamboanga City.
Opo, attorney, bukod po surge nung nakaraang taon, this year naman po makikita sa trend ng COVID cases dyan yung nga pong sinabing pagtaas ng kaso between June at ngayon nga din pong October na patuloy pa rin po yung pagtaas. So binanggit nyo nga po, ang isa sa nakikita nyo dahilan itong Delta variant. Pero ano po ang nagiging pagkilos ng pamahalaan dyan para po mapigilan itong epekto pa rin ng Delta variant?
Alam niyo po ma'am, no, insofar as the Delta variant is concerned, studies have shown that it's much more contagious than the other variants. Ngayon po kasi na-sustain na po yung community transmission. So kung sasabihin, if the question is how do we prevent the transmission, it's really more on the enforcement, the local police together with our partners from the others, members of the security sector. We are really doing our best to limit the movement of the people outside of their residences. But we also have to understand that this pandemic has been going on for almost 2 years, and there were so many restrictions imposed upon the people, and siguro po napagod na yung mga tao, pero it is not an excuse for us to be lax in our enforcement. There are many aspects po ma'am, no, that we are looking into. Siyempre itong ating movement of the residents outside the city. Ngayon po, strictly being implemented na po yung ating quarantine pass, sapagkat nung bumaba po yung mga cases ay we lifted po yung ating use of quarantine pass with respect to letter A and letter B po. No? Yung letter A, yung pwede lang po lumabas sa Monday, Wednesday, and Friday. Yung letter B naman po, pwede silang lumabas Tuesday, Thursday, Saturday. Meron naman po tayong aspeto ng social gatherings, ma'am. Alam niyo naman po dito sa Zamboanga, marami din pong mga social gatherings is also a challenge considering that these social gatherings are being held in air-conditioned settings. So with respect to that, ma'am, it's really the enforcement that we really have to improve on. And yung ibang issues naman po, ma'am, no, with respect sa ating mga isolation facilities, we are addressing this. As I've mentioned earlier, we have the Pasobolong DOH facility. It's near the Mindanao Central Sanitarium, which is a general hospital. We are going to convert it into a step-up facility wherein we will be transferring those exhibiting moderate symptoms who need oxygen. Doon na po natin sila ilalagay. Yung ating isa pa pong facility at Pasunanga Convention Center will be converted also into a step-up facility. And yung ating mga mild symptoms naman po, ma'am, na pwede naman nilang mag-isolate na lang po. We are preparing some 900 beds in our schools from the Department of Education that will be converted into isolation facilities. And we are happy to inform you also, ma'am, that the city government recently is about to turn over this mega isolation facility. Yan pong nakikita ninyo sa pictures, ma'am, which is a capacity of 320 beds. So it will really address our problem on isolation because right now there are many who are doing home isolation because of the lack of facilities. So with the completion of our mega isolation facility, hopefully we can address the situation that we are in right now.
Opo. Attorney, nitong nakaraan po ay marami rin mga nahuhuling na memeke ng RT-PCR test result dyan sa Zamboanga City at mostly po nanggagaling ang mga ito sa ibang lugar. So ano po ang ginagawa niyong aksyon para po higpitan pa rin yung pagbabantay sa ganitong klase ng pamimeke?
Tama po kayo, ma'am, no? There have been several apprehensions already and the actions taken. Meron po tayong sinampang kaso sa korte at they were already sentenced with the appropriate penalties. So the other actions taken, of course, we are very strict in manning our borders. Ang personnel sa mga border checkpoints po natin, ang instruction po is to really verify these RT-PCR test results. And once it is verified that it is false, it is fake, then binibigyan po sila ng citation ticket. And they are recorded and they are also asked to go back to their place of origin at their own expense.
Opo. Attorney, pero sa ngayon po, kumusta naman yung bakunahan dyan? Ilang porsyento na po ng target population ang nabakunahan na?
Sa ating first dose po, meron po tayong 202,582 individuals or this is 29% of the target population. Yung complete vaccinated individuals naman po ay nasa 146,749 or 21% of the target population. Ma'am, I just would like to add also, nakikita natin na ang dahilan kung bakit nga patuloy na tumataas yung mga kaso ng COVID ay dahil nga sa medyo mabagal na pag-usad ng ating vaccination sapagkat kulang pa rin po yung supply ng vaccine na napadala dito sa ating lungsod. Meron po tayong biniling bakuna ang ating pamahalang lokal sapagkat ito ay kailangan natin, ngunit hinihintay pa po natin yung delivery po ng next batch. Ngunit tayo nagpapasalamat po sa coordination po ng ating butihing alkalde, Mayor Ben Clima po, with our National Interagency Task Force Chief Implementer Secretary Galvez, kasama po si Mayor Magalong, pati na rin po yung tulong ni Senator Bongo is they have already pledged po that they will deliver to Zamboanga vaccines po para magpapatuloy natin yung pagbakuna sa ating mga kababayan dito sa Zamboanga.
Opo. Kami po ay nagpapasalamat sa inyong panahon at impormasyon. Attorney Kenneth Baldua, ang tagapagsalita ng Zamboanga City COVID-19 Task Force. Salamat po, Attorney.
Maraming salamat po.